Hello, my name is Susan, and I am a family support specialist for Uplift's chapter of Wyoming's Federation of Families. I'm a parent of 4 children, and as an older grandmother with younger children now breastfeeding their grandchildren, I am here to try to help others learn from myself and some of the things that I learned as a young mother. On behalf of the Wyoming Family to Family Health Information Center, a collaboration between the Wyoming Institute for Disabilities and Uplift, we are here today to bring you a presentation on the importance of breastfeeding. This is an important topic because of the many health and well-being benefits to mothers and their infants. When I was a young mother, I had an old doctor that told me that breastfeeding was instinctual. I soon found out that it was not, and there were quite a few things that were surprising to me. Some of those we will hit as we talk more. Here today with me to talk about breastfeeding is Teresa Wolf. She is a senior lecturer in the Faye W. Whitney School of Nursing at the University of Wyoming and has many years' experience in the public health nursing, working with new mothers and infants in their breastfeeding experiences. I'll let Terry tell you a little bit about herself, and then we will proceed.
Thank you, Susan. I have worked for many years in maternal family health, both as a staff nurse in the public health nursing office in Cheyenne, Wyoming, and as a clinical instructor here at the University of Wyoming with our nursing students. And working with mothers, new mothers and their babies in helping them learn to breastfeed is a passion of mine because I believe strongly in breastfeeding. I believe in the benefits for it. And like Susan, as a new mother, I struggled with breastfeeding. And if it were not for the support of my husband and my sisters and my sister-in-law, I would not have succeeded. And so we will just be discussing also the importance of support. So I believe that the information over the years has changed, and we're going to try to present you with some the most current information that we could find, and try to dispel some of the old wives' tales related to breastfeeding, and hopefully influence young moms there, or even a little older mothers, as I was, to endeavor to breastfeed and to continue to breastfeed for at least 1 year.
Sounds good. Thank you. So, Terry, why is breastfeeding important to consider?
Well, research has shown that breastfeeding protects all babies. And because of the benefits of breastfeeding, we have found that infants with special needs are especially targeted to receive breast milk, especially during the first 2 years of life. Compared to infants who are fed formulas, breastfed infants, they score higher on cognitive and IQ tests at school age and on the tests of visual acuity. They have a lower incidence of sudden infant death syndrome. They are less likely to suffer from infectious diseases such as diarrhea, ear infections, respiratory tract infections, and meningitis. They have a lower risk of the 2 most common types of inflammatory bowel disease, which is Crohn's disease and ulcerative colitis. They suffer less from some of the forms of cancer such as Hodgkin's and childhood leukemia. They have a lower risk of juvenile onset diabetes, and if they are breastfed exclusively for at least 4 months, even if they have a family history of the disease. Breastfed babies are significantly protected against asthma and eczema, and they have a lower risk of obesity in childhood and adolescence, and they even have fewer cavities and are less likely to require braces. And the benefits of breastfeeding seem to carry over even into later life. As adults, we have found that people who were breastfed as infants, they appear to have lower risks of conditions such as high blood pressure, hypertension, heart disease, and even depression. And this recent finding about the lower incidence of depression, we are uncertain why exactly that happens with children that have been breastfed. But they think it's probably because of the positive interaction that occurs between an infant and his mother during that breastfeeding. Breastfeeding the benefits are not limited just to infants and children. They are also important for women And they find that women who are breastfed are more likely to return to their pre-pregnancy weight. They have a reduced risk for long-term obesity. They have a reduced risk of postpartum bleeding. And they report feeling more confident and less anxious as mothers, which we found was really interesting. Less likely to develop ovarian and premenopausal breast cancers. And they have a reduced rate of osteoporosis.
That is compelling evidence. So what are some of the goals for breastfeeding?
Well, with the new goals, or the most recent goals, the American Academy of Pediatrics, we have established goals to increase breastfeeding among infants worldwide. So this isn't just in the United States, they are over throughout the whole world. So what our goals are is that breastfed babies receive mother's colostrum, which we will talk about a little bit more later, within the first hour after birth. And we'll also talk about that in a little bit more depth. And we're also recommending now exclusive breastfeeding for 6 months. No solid foods for 6 months. And continued breastfeeding with appropriate complementary food up to a year of age. And they are finding that, the World Health Organization also has extended this up to 2 years for the developing countries, and this is partially because of the contaminated water supplies that they have in those areas.
What are some of the strategies that will help support a woman's efforts to initiate early breastfeeding?
Well, one of the things we have that is going on worldwide is called the Baby Friendly Hospital Initiative, and this supports helping women to breastfeed within that first hour of birth. And what they are asking is as soon as the baby is born, they do not take the baby from the mother. They can perform their assessments unless there's some difficulty why that baby would need immediate medical care or something of that nature. But if it's a normal, healthy baby, and even in C-section deliveries, that they place the baby right after delivery onto the mother's stomach. And then infants have a crawl reflex, and they are able to crawl to the mother's breast. If you leave the baby alone, the baby is able to find that breast. And if we support that and just keep our hands off, the babies seem to know what to do, and they will find the breast, and they will be able to get started on their nursing. And it seems we have much more positive outcomes with breastfeeding if we allow that to occur in the first half hour.
That's interesting. What should families focus on?
Well, one of the things that we have hopefully tried to get across to you is that families need to be very, very supportive of mothers. They need to be supportive in those attempts to breastfeed for at least a year.
And what are some of the things that they can do to be supportive?
Well, one of the first things we need to remember is that breast milk is digested within about an hour to an hour and a half. If you're feeding an artificial formula to an infant, it lasts in their stomach 3 to 4 hours, and so babies don't have to be fed that often. And it's because it's not as well digested as breast milk is. And so we have to recognize that breastfeeding is time-consuming, especially during those first few weeks, and so families need to be supported, because a baby will nurse between 8 to 12 times a day in those first weeks. And as the baby grows and the stomach increases, he'll take more at each feeding, and the women will not be breastfeeding as long. But one of the things families can, be supportive is realizing this is very much a learned experience for both moms and babies. We aren't born knowing how to breastfeed. Okay,
that's true.
And it is time consuming. And if those infants who have special health care needs or if they have a weak suck, they may tire quickly, and it may take much more time.
Good to know.
Patience is the important thing. So what we recommend is, dads and siblings need to be involved. They do make a difference, because if dads and the older siblings even, if they can anticipate what needs to be done and do it, if there needs to be the laundry done, that frees mom to spend the time with her baby. Okay? They need to encourage the mother in her breastfeeding. Right. And as I said in the beginning, when I was first, learning to breastfeed, if I hadn't had that support from my husband, I wouldn't have made it. Moms breastfeed, but dads can burp. They can get up with the baby during the night. bring the baby to mom, change the baby's diaper. They can do bathing, rocking, all kinds of things. They can be supportive, and they can bring mom a glass of water or a glass of juice. They could rub her neck if she seems like she's kind of, tense. They can cuddle with her while she's breastfeeding. They can talk to the baby, sing to the baby. We've found that fathers, or men, not just fathers, have a very important role to play in the development of a child because of their deep voice, and it's just a different demeanor. It's very important. And if they can allow, and we also say, let dad put the baby on his chest. And it helps to develop those chest muscles as the baby the arm muscles too, as the baby raises up to look at the dad, and it's really cool. Okay. And it's important that dads be part of the comforting. If mom's tired and things, dad can take the baby and calm the baby and give mom a break. So fathers have a very, very important role to play.
Yeah, they really do. A lot of times women are surprised with the realities of breastfeeding, but many of these surprises are temporary and will go away in time. For example, a few days after delivery, when a woman breastfeeds her infant, she may experience the strong uterine contractions. And although these are uncomfortable, it really is an indication that your body is beginning to heal. The strong uterine contractions help prevent postpartum uterine hemorrhage and aid your uterus in returning more quickly to its pre-pregnancy size. These will diminish within a few days, so it's a very temporary thing. Another surprise is how strong infants can suck. Not something that you may be prepared for right off. Mothers frequently refer to their infants as a little barracuda. Take several deep breaths to help you relax and rejoice in your infant, that he is so strong and so healthy. Your breasts will very quickly get used to getting the strong latch.
The other thing that some women report is tenderness on their breasts, and it's important for them to realize that breast tenderness is normal for the first few days. However, it should not be painful. If your infant is latching on and it's painful, he is not latched on correctly. So what you need to do is to make sure that you stick your finger in the side of his mouth and kind of gently break that suction. Don't just pull him off, because that's going to damage the nipple. And make sure it's a clean finger also. And then she needs to remove the nipple from his mouth and then reposition herself and the baby and see if she can get a better latch.
What are the signs of a good latch?
A good latch is important for a baby because during those, and it takes time to learn that. And a latch will feel comfortable, it won't hurt or pinch, and how it feels is more important than how it looks. The signs that you have a good latch include the fact that the baby's chest is against the mother's body, and the baby doesn't turn his head away from the mom when he is drinking. When the baby's positioned well, his mouth will be filled with breast, the tongue will be cupped under the breast, and although the mom might not see that, she will see or hear her baby swallow. That's a very important thing. So if the baby's just going and not swallowing, the baby's not latched on and is not getting milk. Some babies swallow quietly, so only thing that you may see is a pause in their breathing. That's a sign of swallowing, and their ears wiggle slightly. The baby's lips turn out like fish lips, and she oftentimes is not able to see the bottom of it. And the baby's chin will touch the mother's breast.
Some babies latch on right away, and for some it takes more time. Since a good latch is important for successful breastfeeding, what can a mother do to get her baby to latch correctly?
Well, first thing she needs to do is to tickle the baby's lips to encourage him to open up wide. And then she needs to pull the baby close to her so that the chin and lower jaw move into the breast first. And then she needs to watch the baby's lower lip and aim it as far back from away from the base of the nipple as possible, so that the baby takes a large mouthful of breast.
some moms and babies find it difficult to find a comfortable position for breastfeeding. What sorts of breastfeeding holds might be helpful?
Well, all babies eventually find a preferred position, and it's often just a matter of trial and error for a mom. Encourage her to try any of the following positions, and she can until she's assured that she has a good, comfortable latch. She can use pillows under her arms, elbows, neck, or back to give her some added comfort and support. She should try different positions. One of them is the cradle hold, and it's an easy, common hold that's comfortable for most moms and babies. She'll hold the baby with his or her head on her forearm and his body facing hers. Okay. Then there's the cross cradle hold, or what they call the transitional hold. This one is very useful for premature babies or babies with a weak suck because it gives extra head support. And it may help babies stay latched. Mom will hold her baby along with the opposite arm from the breast she is using and support the baby's head with the palm of her hand. The next one is the football hold, or sometimes called the clutch, and this is very useful for moms who've had a C-sections or moms who have large blasts, flatted or inverted nipples. Excuse me. And it also helps for those babies that need to be more upright. Sometimes babies that have cleft lips or palates need to be held more upright, and the football hold allows them to use that. Another one is the sideline position. This is very useful for mothers who have had C-sections because the babies are not laying on their stomach. And the mom just simply lies on her side with her baby facing her, and she pulls the baby close to her so it faces her body.
Interesting. So how much breast milk does an infant need?
Well, the first milk that a mother makes is called colostrum, and colostrum is that thick and yellow and rich in nutrients, and it's very important to infants in those first few days, and especially infants that have special needs, special health care needs, because it's packed with antibodies that help to protect the baby's health. We sometimes call colostrum liquid gold just because it is so concentrated in all the good things that the infant will need. A woman produces about 100 milliliters, or about 6 tablespoons of colostrum every day for the first 3 days, and this is all an infant needs. People sometimes think, oh my goodness, they've got to have 6 8-ounce bottles. But you have to remember that a newborn's stomach is only about the size of a hazelnut, which is about this big. So we're giving an infant about a tablespoon of colostrum about 6 to 8 times a day. Once the mom has begun to produce mature milk, usually about the day 3, then her baby takes between 19 and 30 ounces. But unless a mom pumps and puts it in a bottle, she isn't going to know how much the baby's taking. But
so,
there are signs.
Oh, excuse me. So how does a mother know when her baby is hungry?
When a baby's hungry, babies will give specific cues. They will let you know, and it's important that moms watch for these cues. Back in the olden days, they used to tell us, just wait till the baby is screaming and then pick him up. Don't pick him up until he's screaming. Well, we found out that really, really is detrimental to children. So what we need to do is to be moms need to be cued in to what's going on with their babies and watch them, because first the baby will start to become a little bit more alert and active, and they might put their hands or fists in their mouth. They'll make sucking motions like that. That means that that they're looking. They'll turn their heads to look for the breast, or if anything touches, they will turn their cheek. They'll turn towards it, like with rooting. So as soon as a mom notices these cues, she needs to pick up the baby and offer her breast. As I said, don't wait until the baby is screaming his head off, because it's very difficult to get an infant that is that upset to latch on. And it's normal in those first few days to feel like you're not going to ever get this figured out, but you're learning a new task.
That's true.
Okay. If a mom feels frustrated in her attempt, some of the things that she should do is take a break. Just take some deep breaths, hold her baby in an upright position, and talk to the baby. That will calm an infant down. I used to love to do that with the new moms and show them to say, hi, it's not that bad. It's okay. And they just get all excited. Then they're calmed down, and then they can go back and start. She can try talking to him, walk around, rock the baby. I used to have to stand up and rock my son back and forth like that. If she feels very frustrated, again, be very cautious because this is how babies get shaken. Give the baby to somebody or put the baby down and walk away and make sure the baby's safe. And when she's ready to try again, then she needs to try and use skin-to-skin contact. Research has shown this really does help to calm a baby down. She just needs to take everything off the baby but the diaper and put the baby right against her bare abdomen, and that really will help her.
And so what if the infant still is unable to latch?
Well, sometimes that is because the mom's breasts in the initial stages are too full and too hard. So what she'll want to do is she'll want to express some breast milk just to get her breasts soft enough so that the baby can latch on and grasp the areola. But make sure that when she expresses that breast milk, that she saves it into a clean container, because if for some reason she still can't get the baby to latch on, then what we recommend is to feed the baby a little bit of breast milk using a small spoon or a soft cup, and just give it to the baby on the spoon or the cup and let the baby lap it up like an infant. Sometimes that is enough to get the baby to calm down enough, and then she can put. The important thing is never give in and give a bottle, or you've lost the battle.
Okay, so perseverance would be definitely the trick. Mm-hmm. What about nighttime feedings?
Well, it's real important. You know, new moms are always tired, and all you do is for that first 3 months or whatever, you just pray that baby's going to sleep all night long. But it's not a good thing. We have found that we cannot let infants. This is normal full-term infants go for more than 4 hours without sleeping. Premature infants with special health care needs may need to be fed more frequently, so you're going to have to wake up the baby if the baby does not wake up. So, because if you don't nurse the baby during the evening or during the night, their blood sugar can drop. And if it drops too low, then you're going to have to take the baby to the hospital and have to give them IVs and all kinds of stuff. So it's easier just to wake them up and feed them. Okay?
So where should the baby sleep?
Well, it's very tempting with breastfeeding moms to want their babies to sleep in their same bed with them because it's just easier to pull them to them. Yeah. But we're saying that's not recommended. They should always sleep in a separate bassinet or crib in the same room as the mom, but they shouldn't sleep in the same bed. And some parents they should always sleep on their backs with a firm mattress and without soft pillows around them. Some parents think that they should buy those co-sleepers that pull up to the bed, and the American Academy of Pediatrics does not recommend those at this time. There's too much danger of injury to an infant with the co-sleepers or the co-beds, bedside sleepers or the co-beds.
So some of the things that I think a lot of new mothers may want to know is how do they know that their baby is getting enough milk?
Okay. Since they're not measuring and we're putting it in a bottle and feeding it to them, the way that we find out that we know for sure that they are getting enough milk is there's little signs. Usually the feedings will be 15 minutes or longer, but what you really will see is that the cues are that they have at least 8 to 10 wet diapers a day, and that the urine in those diapers is kind of a pale yellow, and it's not. If you notice that the urine is real orange or deep yellow, the baby's not getting enough. 4 to 5 initially, we say 3 to 4 bowel movements a day. Some infants will have 6 to 8 in those first weeks, and that'll gradually slow down because they use the breast milk so efficiently. But it's normal to have that many. The infant will switch between short sleeping periods and wakeful periods, and the infant feels very content. Okay, it's very important. It's that you don't give breastfeeding babies additional water. Somebody will say, "Oh, it's hot, and you need to give your baby a bottle of water." No, that's not true. Breast milk is water, and that's where they get it. And we have found that babies are driven to feed not because they're hungry, but because they're thirsty. So if you fill them up with water, they don't feed.
Right.
Okay, and then the blood sugar goes down, and then you get real problems. So no extra water.
So when should a breastfeeding mother call the baby's health care provider?
Well, the first thing is if her milk has not come in within 5 days, that mature milk, and I mean that's between 3 to 5 days. If it has not come in, she needs to notify somebody. But also, with regard to her infant, if she is not able to get the baby to latch, regardless of everything that she tries to do, then she needs to call for some help. If the baby has a weak suck and is just making sucking movements and is not getting the nutrients that they need, if they aren't having at least 8 to 10 wet diapers, if they're lethargic, very difficult to awaken, they have jaundice, which is very common, and we see this, and they start to get a little bit yellow-tinged eyes and whites of the eyes. In years past, when babies got jaundice, they used to have the mothers quit breastfeeding, and we have now found that that's the worst thing we can do. Mothers need to breastfeed frequently because it helps to break that bilirubin down and helps to break that and get it flushed out through the bowel. And so unless there is a real medical reason, a baby with jaundice should always be breastfed.
Interesting. When should a mother introduce solid foods for her baby?
As we said in the beginning, it's recommended, we're recommending that they exclusive breastfeeding for at least 6 months, and after 6 months, then she can start to introduce solid foods. And again, one food at a time, just like we've always said in the past. But just to check to make sure that the baby hasn't gotten any allergies. We always say one food every 3 days to make sure the baby is not allergic to it. One of the other old wives' tales, and I went through this with my son, was to give him rice cereal. And because if you gave him rice cereal, he was going to sleep all night long, and you know what? It doesn't work. Babies sleep when their neurological system is ready for them to sleep, not because they're full of rice cereal. The only thing we managed to do was probably give them some food allergies, or just we frustrated both of us.
Right,
so,
right.
Exclusive breastfeeding 6 months, then you can start introducing solids.
So what about the mom? What should the mom be eating?
Well, a woman doesn't have to be on any kind of special diet, and she doesn't necessarily, despite what we have been saying for many, many years, have to take in extra calories. A woman's body is designed to produce healthy breast milk, and it is sometimes, though, if a woman does not have a healthy, balanced diet, her body is going to rob herself of the nutrients to make sure that baby gets what they want. So if you don't have a sufficient calcium intake, you're going to start losing calcium in your teeth, you're going to start losing calcium in your bones. So we just say do a healthy, balanced diet according to the USDA's healthy eating plates with the whole grains, fruits, and vegetables. And as I said, dietary calcium is very important. You need to make sure that she's taking milk, yogurt, cheese, and if she can't get that, she can use some of the vegetables, Chinese cabbage, kale, broccoli and sardines. There's some of the calcium fortified juices. Or her physician or her healthcare provider may recommend that she take a calcium supplement if it seems like she is whatever. And as far as extra calcium goes, or extra calories, she only needs to have as many calories as it takes to maintain her weight. If she is losing weight very rapidly or has lost more weight than she really wants to, then she probably needs to increase her calories. If she increases her calories and starting to gain weight, then she needs to cut back. So any extra calories that she does really do need to be in terms of healthy foods.
Right.
So, okay. The only other thing is go ahead. Okay. And eating a variety of foods, one of the things that we were talking about yesterday is that they have found that if a woman eats, a very bland diet, her milk is going to be very bland, her breast milk. But if she eats spicy foods or different ethnic foods, that introduces her baby to tastes and smells of those particular foods.
That's interesting.
Yeah, it's kind of exciting.
So how much fluid should a breastfeeding mother drink to maintain her milk supply?
Well, we used to say you just had to push fluids and push fluids. Now we just say, if you're thirsty, drink. right now, I'm thirsty, I would like a big glass of water, and if I were a breastfeeding mother, I should be drinking a glass of water. So one that we usually say at least 8 ounce glasses, and it's an easy trick is every time she sits down to nurse her baby, put a glass of water next to her, and she can drink it while she's nursing, and it's an easy way to remember it. We recommend avoiding sugary drinks because these are non-nutritious, they increase weight, and caffeine drinks. You need to be cautious about that. Some women do okay with it, some babies do okay, and some babies can't tolerate the caffeine at all in the breast milk. So we kind of recommend, don't drink caffeine. If you absolutely have to have a cup of coffee in the morning, drink some water with it too. So, okay?
So how can a mom continue to breastfeed her infant if she's returning to work?
That's always a problem for women, and that is where we are seeing women stopping breastfeeding, is when they go back to work because it's so difficult. But we're finding that with a lot, again, if we get support for these women, they can be successful. We would love for women to be able to take off at least 12 weeks to be able to get breastfeeding established, but most places we know that's not real. So if they can at least get 6 weeks off, that would be fine. So some of the things that she's going to have to do is to find a supportive daycare provider who is willing to work with her. And you need to make sure she needs to interview the daycare providers and say, if I'm not here and my baby's hungry, what are you going to feed him? And if they say we're going to give him formula, you say, no, I'm going to be bringing you breast milk. Will you feed him breast milk? And they say, no, we're going to give him formula. Then I'd find another daycare provider.
Absolutely.
Mine used to drive me crazy because she would feed him at 4 o'clock, and then I would pick him up at 5 o'clock, and I was ready to nurse, and he was full. And so those are the kinds of things that you need to work with your provider. And then she needs to plan that she's going to pump every 2 to 3 hours while she's at work. So if because she's going to have to pump, she's going to have to find some kind of private place, such as an office that's got a door, a conference room, or a storage closet. If she's using an electrical pump, she's going to have to find some place that has an outlet. And some place too where she can suitably store her milk so that it stays cold. A restroom is not the place to pump. Oh. It is not sanitary. Years ago, I remember working with women up in the Hathaway building over at the State, and they would go in the bathrooms and pump, and that's not where we should be. And I think it's very important that we tell women that the Affordable Care Act, the new Health Care Reform Act, supports work-based efforts to assist nursing mothers. And the U.S. Department of Labor is proposing new regulations to allow nursing women reasonable break times in a private place other than a bathroom to express their milk while at work.
So what are the different ways that a woman can express her breast milk?
Well, she can do hand expression. She just uses her hands to compress her breasts. This is okay if she's going to do some occasional pumping. She can use a manual pump, and that's just usually if you squeeze and it works, and that's all right, again, for occasional pumping, but it doesn't work over the long run usually because it doesn't empty the breast completely. But if you're only going to be, you're going to go out or something and you need to pump, but for long-term use, it doesn't work. So what we recommend if a woman is going back to work is that she invests in an automatic pump. And these things run on batteries or plugs, plug into an outlet. They're more expensive, but over the long run, if she's going to be working, and she needs to check and see whether or not some places will rent these, and sometimes WIC has them and they can provide them, and sometimes the hospital have them and they can provide them.
Gotcha.
So she just needs to look around. There are hospital-grade pumps that can be rented from some of the lactation consultants, and they work well to help establishing the milk supply, but they're very expensive, and I wouldn't recommend that she buy one of those for long term. She doesn't need to go into that. It's also important that she remember that she needs to wash all of the components of the pump out with soap and water, the washable components with soap and water after each use, and never share pumps. Women should never share pumps with each other because there is a possibility that there is some bacteria that could be transmitted to the mother or the infant.
So how should a woman store the breast milk that she has expressed?
Well, once she's, again, we always recommend that she needs to wash her hands before she is going to be expressing, but she can still store them in, say, in some containers that have like screw cap bottles, hard plastic cups, heavy-duty bags that are designated for storing. We do not use the formula bags or just regular plastic bags that you buy, because those can get pinholes in them that allow bacteria to contaminate the milk. So, and if she's going to, once she has put them in some kind of appropriate storage container, then she needs to make sure that she clearly labels it with the date, so that she can, when if she's freezing it, that she'll be using the older milk first, and that if she's going to be delivering it to a daycare provider or child care provider, she needs to make sure that her child's name is on that. So if there's several mothers that are breastfeeding and bringing milk, that they don't get confused. It's important that she doesn't add any, when she pumps, that she doesn't add fresh milk to milk that's already frozen, because that can thaw that frozen milk and contaminate it. And she should not save milk from a bottle if it's been more than an hour or two for the next feeding, because those get bacteria in them. There's some of the guidelines that they have come up with. If it's going to be on the countertop, they say at room temperature 6 to 8 hours. If it's in an insulated cooler bag that she is, say they're traveling or whatever, if it's iced down, she can, 24 hours is good. Refrigerator 5 days. It's important to note that there's a difference between the freezer compartments in your, like the upper freezer compartment side by side or a deep freeze. Because if a regular freezer compartment, maximum time is 2 weeks, because you're opening those things and they get warm. If you were in one of the freezer with like a side-by-side, you can go sometimes up to 3-6 months. And if you've got a chest or an upright deep freeze, maybe even up 6 to 12 months. But again, they always should be in the back.
So Terry, what are some of the tips that you would have for breastfeeding in public?
Well, some women don't feel very comfortable breastfeeding in public, but sometimes it's very important that it's necessary that they do, because you've got this screaming child and you need to do something. But she needs to remember that even though it's her right, that she does need to be discreet. And she does need to remember also that there are federal laws that do protect a woman's right to breastfeed her child in public. Some of the tips that we say is, wear clothes that are easy access. Don't wear a sports bra, probably, because that's probably not easy to, well, it might be easy to pull up, but use a special feeding blanket around. She needs to maybe use a sling, but be careful with the slings, because some of those infants can get kind of caught up in them a little bit. But she needs to try to slip into a woman's lounger. If she's at the mall, some of the stores, the larger stores have dressing rooms. You know what you go in. Some malls have. I think the Cheyenne Mall used to have. I don't know that they still do. They had a baby store out there where they had a baby-friendly room where women could come and breastfeed.
Interesting.
The most important thing is that she practice at home before she goes out, so she's comfortable. So this, when she's in the middle of Walmart and she needs to feed, that this isn't her first time that she's trying to nurse.
That is huge. I know it isn't good for anyone to be smoking cigarettes, but if a woman is smoking, should she continue to breastfeed her baby?
It is very important if women smoke that they do plan to breastfeed, because babies who are in households with adults that are smoking are more prone to infection, and especially ear and upper respiratory infection. And breast milk gives that added extra boost of the immunity that helps them strengthen the baby's immune system and helps fight off those breast infections. It is important, if she's going to breastfeed, that she wait at least 30 minutes after breastfeeding, because fortunately the nicotine in our body does drop. That's why people who smoke need to have a cigarette every 20, 30 minutes. That's right. We're always outside. We were always outside. We don't do that anymore. But
No.
we used to. Years and years ago. Anyway, and so they said, the studies say that it peaks 30 to 60 minutes after that you can drop it. Okay. So she needs to go outside. She needs to wear something that covers up, because what we find is that the smoke has chemicals that get in your clothes. So put on a jacket, and then go outside and smoke. Come back in, take off your jacket, wash your hands. Wait 20 to 30 minutes, and then you can breastfeed. We do not recommend using nicotine patches, gums, lozenges within 2 hours because of breastfeeding, because of the high concentration of nicotine in those. And in reality, it's probably best not to use those at all if you're breastfeeding.
Well, how about if a mom wants to have a drink or two?
Well, one of the things we used to say was, and if you're going to drink, just pump and dump, and then you can you can go back and nourish your baby. But now we've found that, that the level of alcohol in the breast milk is equal to the level of alcohol in a mother's bloodstream. And so if she's got a 0.08, which is legal limit in her blood, she's got that in her breast milk also. So she needs to wait until that blood alcohol comes down, and the way that she can figure that out is that it takes about an hour to metabolize a drink, which is equal to 5 ounces of table wine, 12 ounces of beer, 8 to 9 ounces of malt liquor. I was surprised that malt liquor was higher concentration.
Yeah.
And 1.5 ounces of any hard liquor such as vodka, gin, and bourbon. So she needs to wait at least an hour for every one of those. Now, if she's had 2 drinks, she waits 2 hours. She drinks a lot of water. She'll probably be safe. Her breast milk will probably be back down to a normal level. However, if she has more than 2 drinks, and she's going to need to wait more than 2 or 3 hours to breastfeed, she's probably going to get very uncomfortable, and then she should just pump and dump. And hopefully she's thought ahead of time enough to be able to save some milk, or pump some milk, so that somebody can feed her baby some breast milk and won't have to feed them any formula.
So what about prescription drugs, over-the-counter medication, herbs? Can a woman safely take these while she's breastfeeding?
Well, it depends very much on what the medication is. Some are low risk, some are high risk. And there is a manual out that rates all of the prescription medications and many of the over-the-counters. And for example, we know that antihistamines that people use frequently for colds, they dry up your breast milk and they can make your baby very drowsy, because that's what they do. So that can really decrease your breast production. Women think that herbs are safe, and we have found that there are some herbs that are not safe. And so it's really recommended that she not take those. And some people will tell you if you take specific herbs that will help increase your milk production, or specific medications, and we found that most of the time that doesn't help. The only thing that helps in increasing breast milk production is frequent feeding. So we're saying discuss any medications, whether it's over-the-counter, prescription, herbs, whatever, with your healthcare provider, and find out what's safe and what maybe they can switch you to something else if there isn't.
What about recreational drugs such as marijuana?
Never, ever, under any circumstances, should a woman use any kind of recreational drugs, even marijuana, even if it is legal in Colorado. Should not be using them.
Is an infant born with a cleft lip or a palate able to breastfeed?
Absolutely, and it depends upon the severity of the cleft. If an infant with a cleft lip or palate, they're very prone to ear infections, and so we do recommend that they do breastfeed, or at least receive the breast milk however best they can. Sometimes a baby can be positioned such that they that they are able to feed at the breast. Sometimes they can't, but if they're able to feed directly from the breast, we really do recommend it, because one of the things we've found is that breastfeeding for infants that have cleft lips and palates, it really helps to strengthen those face and mouth muscles. It helps to contribute to more normal facial formation, protects against ear infections, promotes better speech. Another advantage is that, breasts are much more flexible, and they can conform to a baby who has a cleft lip or palate. And there's sometimes that then they're able to get more control over that. If it's very severe, their provider will probably fit that infant with some kind of mouthpiece that they use to prevent the milk from going up into the nose or whatever. If they're not able to feed, it's very important that the mom, as I said, she pumps, they give the baby the breast milk, because remember, it's not the feeding at the breast, it's the milk, it's the breast milk that has the benefit. Interesting.
So what if an infant is unable to feed directly from its mother's breast?
Well, there's occasions, we know that, where infants are very ill, premature infants, infants that are in NICUs, infants with cardiac problems or whatever that are too weak or are hospitalized. And in these instances, again, even starting with the colostrum, the mother should pump, somehow express the milk, and get the milk so that they can feed that to the baby, because it helps to strengthen that baby's immune system. There's fewer problems with digestion, and babies do better. They grow and flourish much better. And usually the babies will be fed with a tube. They'll have a tube through their nose into the stomach, and they'll put the breast milk in, and the mother and the mom feels that she's very, very involved then with her baby's care. She feels like she's contributing to her baby's health and well-being, and it also increases that bond. She doesn't feel like she's just this, side view or person over there.
So where can a mom find information about common breastfeeding challenges?
Well, there's a lot of different websites, a lot of different resources, which has some. But one place that I found that I really think has excellent and up-to-date information is the womenshealth.gov website. And they have information about sore nipples, low milk supply, oversupply of milk, engorgement, plugged ducts, breast infections, fungal infections. What do you do when your baby goes on a nursing strike? How do you handle that?
Exactly.
Inverted, flat, or large nipples, breastfeeding a baby with specific health problems, breastfeeding special situations, and more information on common breastfeeding.
So what final words do we have for women who want to exclusively breastfeed for 6 months and continue for a year?
Well, the purpose of our being here, Susan, as we said in the beginning, was to give mothers information, give them some tips and some resources so that she can be successful. So even if you weren't able to, I know you said that you had difficulty feeding your first son.
I did, yes.
But you were able to successfully feed your second child?
And third and fourth.
Yes, so
yes.
Don't get discouraged. Even if you had problems that first time, don't worry. You can still be successful. And don't forget to ask for help. Every one of the counties in Wyoming has public health nursing offices. They offer breastfeed greening programs, welcome home visits. We have WIC offices that have a tremendous amount of information. Your healthcare providers, many hospitals now have lactation consultants, and so in the long run, we just want to remember that, to tell women, we want women to realize, that breastfeeding is very important, and we're very encouraged because the Centers for Disease Control is reporting that more women are starting to breastfeed, initiating breastfeeding. So, perseverance, encouragement, and we hope that if she perseveres, it's going to be worth it. If she will feel it is worth it in the long run for both herself and her infant. And remember, breast is best.
So I want to thank you for joining Teresa and myself today. For more information and materials on the importance of breastfeeding and other healthcare topics for children with special healthcare needs, please visit the Wyoming Family to Family Health Information Center at website www.uwyo.edu/wind/F2F. And we'd like to thank you for joining us today.